He's the man that's been leading Cumbria's public health response to COVID-19. And with infections on the up, Colin Cox is concerned.
The rates are still rising in Cumbria, and they've been steadily rising for the last 3 or 4 weeks now. So they're going in the wrong direction, albeit slowly. So it's really important that we do continue to take the sort of action that we need to take to try and bring this under control.
With the figures as high as they are, he was surprised with the Prime Minister's announcement on Tuesday. He welcomed the decision to close pubs and restaurants at 10 p.m, but thought Mr Johnson would go further and ban households mixing indoors, like the First Minister did in Scotland.
I have to say I was expecting this week that there would be a further restriction on the national rule of 6 to bring it down to a smaller number of households. I understand why, of course, the government's wanting to take these things in steps. Social contact does matter. It's important for people's mental health and for people's well-being. And so I understand why the government's trying to reduce the impact of that.
Mr Cox now believes that further measures are inevitable, and they could come sooner than you might think.
They've said we'll see how this goes for now. They've said 6 months, but you wouldn't be surprised if there was a ban on visiting inside homes in Cumbria.
Oh, I think that these restrictions might come in place nationally, not just within Cumbria, far sooner than 6 months.
His comments come as the latest figures show confirmed COVID-19 cases have continued to rise across the region. In Cumbria, 105 new cases were recorded in the week ending the 18th of September. That's up from 82 cases the previous week. For the third week running, Barrow had the highest number of new cases with 38. South Lakeland recorded 17 infections. There were 16 in Allerdale, 15 in Copeland, 11 in Eden and 8 in Carlisle. North of the border, figures for the same week ending the 18th of September show 18 infections in Dumfries and Galloway and 48 in the Scottish borders. In Cumbria, with the exception of Barrow, the number of new cases being reported continues to be significantly below other areas of the northwest. Over 13,000 tests were carried out last week, with just under 1% returning a positive result. New cases continue to be most common among 15 and 29-year-olds, but there's increasing evidence that's spreading to older age groups. But for the moment, hospitalisations remain low and no deaths have been recorded in the last 2 weeks.